English shorthand dictation exercise number 43. Dictation speed 150 words per minute. Ready, start. The India Meteorological Department has said that heat wave conditions are very likely to continue in northern plains of India till the end of May. In the plains, a heat wave is declared if the maximum temperature of a station reaches at least 40 degrees or more. In the last few years, heat waves have emerged as a major severe weather event in India. 23 states were affected in 2019. This shows the increasing severity of heat waves as a lesser number of 19 states had been affected in 2018. The number of heat wave days in a year and its severity is expected to increase in the future thanks to the climate crisis. In India, more than 6,000 people have died because of heat waves since 2010. The maximum number of deaths in the last decade was in 2015, when 2,040 people died. However, data does not capture the actual number of deaths due to heat waves. This is because while deaths due to heat stroke and heat exhaustion are recorded, overheating of a human body can also lead to organ failure, stroke, and cardiac arrest. These are seldom recorded as heat wave deaths. The National Disaster Management Act 2005 and the National Policy on Disaster Management 2009 also do not have heat waves in the list of natural calamities, though they are the third biggest natural causes of deaths. The NDMA has a heat action plan that provides a framework to states for the implementation, coordination, and evaluation of extreme heat response activities. The plan outlines strategies such as establishing an early warning system, training healthcare professionals, improving community outreach to alert people, setting up temporary shelters, and improving water delivery systems. Cities such as Surat and Bhubaneswar have implemented many of the guidelines, but most states are lagging. This year, heat waves have started when states are busy tackling the coronavirus pandemic and the migrant crisis. A few states are even tackling locust attack. These concurrent disasters have put pressure on the state machinery, but states have no choice and they must implement the NDMA guidelines to save lives. India's farms are facing a significant threat from a swarm of millions of locusts that have migrated from Africa and have now entered deeper into Rajasthan, Madhya Pradesh, and Uttar Pradesh. This swarm originated in East Africa, where excess rains triggered a breeding boom. According to experts, the swarm, which is entering India now, had another round of breeding in Balochistan, Iran, and Pakistan. Officials have put farmers on high alert and deployed insecticide spraying devices through drones and tractors. Locust invasions are common in parts of Rajasthan, but this is the first time they have reached Jaipur. The Locust Warning Organization under the Ministry of Agriculture has a ground team of 50 people, mainly to monitor and track the swarms. The organization is coordinating with the India Meteorological Department to determine the trajectory of the swarm of locusts. Presently, 3 groups of locusts are in action, and the first one among them is moving towards Uttar Pradesh based on wind direction. The second lot seems to be heading for Madhya Pradesh. The third group is in Jaipur region. Locusts can fly up to 150 kilometers in a day. Locust swarms can cover extremely large areas, which can sometimes be extremely remote and difficult to access. The Food and Agriculture Organization monitors locust swarms on a 24-hour basis and provides forecasts and early warnings, alerts on the timing, scale, and location of movement. Locust invasions are known to cause a considerable drop in agricultural output. As per the Food and Agriculture Organization, a 1 square kilometer swarm can eat as much food as 35,000 people in terms of weight in a single day. Locusts do not attack people or animals. There is no evidence that suggests that locusts carry diseases that could harm humans. According to some assessments, the locust outbreak this time is linked to climate change and unusual rain. Traditional chemicals are used to control their numbers. Now, nature-based biopesticides are also available as a less harmful alternative for controlling outbreaks. The trail of death and devastation that cyclone Amphan has left in West Bengal and Odisha demonstrate once again the fragile state of eastern coastal states during the storm season. More than 70 people are dead in Bengal and normal life is paralyzed for millions in Kolkata and in the rural areas of both the states. It was anticipated that the Amphan would be a terrible disaster, but even with reliable forecasts of its movement since May 16 and the preparatory moves by national and state disaster response force units, the impact has been catastrophic. The states along the east coast have evolved a code of practice for a storm coming under category 3 and above. This includes evacuation, arranging for backup power, warning people to stay far from the coasts, designating strong buildings as cyclone shelters, and providing for at least a week's supply of cooked food, besides bolstering medical supplies. Yet the loss of life and damage to livelihoods is always significant. This time has been no different, and the center and the governments of the affected states must help people pick up their lives again. There is an additional challenge as thousands of people have been moved to crowded shelters where the coronavirus pandemic poses a continuing threat. Adhering to hygienic practices, monitoring those requiring medical assistance, and testing for the virus is a high priority. India's cyclone warning system has made major advances for being able to provide clear warnings and saving lives, but the precarious lives led by millions of citizens have once again been subjected to a severe shock. Many laborers and workers who were working in distant states have just returned to Odisha and Bengal in the wake of economic paralysis caused by the pandemic. They need sustained support after the storm. The Chief Minister of West Bengal has appealed for strong support from the center. The state must be provided help to overcome the double jeopardy of the pandemic and the cyclone. Encouragingly, some vital activities such as functioning of the Kolkata airport were restored a day after the cyclone struck. This facilitated the movement of essentials and deployment of additional NDRF personnel to restore normalcy. The challenge is to provide prefabricated facilities for safe shelters in outlying areas such as the Sundarbans. While the battle against the virus may yet be won sooner or later, India must strengthen its response capabilities for a never-ending cycle of storms along its coastline. Overseas citizens of India are being slowly allowed to return to their country of origin. Following the pandemic-induced entry ban placed on OCI holders, there should be some introspection on the future of OCIs. Overseas citizen was always a misnomer as a holder did not have a status anything close to citizenship. They did not carry Indian passports, had no political rights, and faced restrictions such as being disallowed to buy agricultural land. The fate of OCI holders has made it clear that this is just a long-term visa with minor economic benefits grafted on a traveling convenience, but not much more. The OCI regime needs to be reformed so that it fulfills the promise of its name. Many of the economic restrictions on an OCI holder makes little sense in an age when India is chasing foreign capital and investment. Holders should have the same financial and commercial freedoms enjoyed by an Indian citizen. More ambitiously, a pathway should be laid out with the idea of making OCI the basis for genuine dual citizenship. Given the size of the Indian diaspora, their economic and technological contribution, and the government's embrace of ethnic nationalism, this should be a natural policy progression. The Citizenship Amendment Act has normalized the principle of prioritized immigration. Dual citizenship can be initially negotiated with certain countries and weighted in favor of those with educational or economic qualification. Over a period of time, as India becomes more comfortable with the idea, it should be expanded and treated as a natural component. The OCI system is at the crossroads. It needs to either change its name to fit its present status as a glorified visa or become a precursor to a passport bridge between India and its friends. In coronavirus times, what Kerala thinks today, India should think tomorrow. Kerala has over 800 coronavirus cases, yet so far only 4 have died. Mortality in other states is far higher. For example, Gujarat, with one of the highest mortality rates in India, is reporting over 800 deaths with over 13,000 cases. Kerala was once derided for its failure to create jobs. The Chief Minister of Uttar Pradesh mocked Kerala's healthcare record, and Prime Minister described infant mortality among Kerala Adivasis as worse than Somalia. But today the internationally acclaimed Kerala model has delivered better than the trumpeted Gujarat model. It is not just Kerala. South India as a whole is managing the pandemic more deftly than the north. In Tamil Nadu, cases have risen sharply, yet mortality is relatively under control.